Hi, I'm Dr. Daniel Carlat, and I'm the editor of the Carlat Psychiatry Report. I'm also the publisher of the Carlat Addiction Treatment Report and the Child Psychiatry Report. I'd like to describe for you an upcoming issue of the Carlat Addiction Treatment Report. First of all, we have a new editor-in-chief for that newsletter, Dr. Josh Sonkis, who is an addictions expert in Fairbanks, Alaska, who is also the past president of the Alaska Psychiatric Association. And I think he's put together a great issue. He's put together an issue focusing on dialectical behavior therapy, not for borderline personality disorder, which is what we tend to associate that with, but for substance use disorder. So the issue includes two articles, one of which is a kind of a primer on dialectic behavior therapy for substance use, and the other is a great interview with Dr. Marsha Linehan, who, as many of you know, is the founder of DBT. She discusses the various skills that are part of this technique. The main overarching theme is what's called dialectical abstinence. And as with all dialectical behavior therapy techniques, what that essentially means is realizing that the patient has to change, but also encouraging them to accept themselves for who they are. So that's the kind of opposing thesis, antithesis that come together into a treatment that really works. So in terms of addiction treatment, we want to emphasize on the one hand, complete abstinence, but on the other hand, we want to encourage patients to accept the fact that in all likelihood they are going to slip up at some point, and we don't want them to view that as a huge catastrophe. Instead, we want to be able to teach them and provide them with a series of specific skills to move from relapse to recovery and abstinence. We go through these skills in some detail in these articles with some nice tables that you can refer to. One of them is simply called clear mind, and that means being fully aware at any given point that you can slip back into addiction at any time. So that means when you're in the bar, not thinking that you can have a beer, but realizing that that's going to potentially cause you to slip back into a relapse. Another one is called burning bridges and building new ones. So that's essentially exiting yourself from places and from people that you associate with craving and with addiction and finding new connections. So stop hanging out with Joe at the bar and start hanging out with Mike at the tennis court, that type of thing. Again, sort of common sense skills and advice that we often give our patients. But the nice thing about this is that it sort of systematizes these things and reminds us to keep a running list of skills that we want to teach people. One of my favorite skills is called alternative rebellion. This is particularly good if patients view substance abuse as a way of rebelling against society. And if so, we want to teach them a safer way, an alternative way to rebel. And you can go online under alternativerebellion.com or other such sites and find lists. Patients can find lists of things like get your ear pierced, or play hip hop music really loudly, or go buy a crazy bumper sticker. Whatever kind of gets you out of your comfort zone and makes you feel like you're rebelling in a way that does not lead you to relapse. Also in this issue, we have a really interesting research update where we summarize a review article that looked at about 11 epidemiologic studies about gabapentin or Neurontin as a drug of abuse. Some of us have heard about correctional facilities and how prisoners are looking for a gabapentin, as well as others, things like Seroquel as a drug of abuse. Turns out that about 1% of the entire population internationally abuses Neurontin. It's a euphoriant, particularly when it's combined with alcohol or benzodiazepines or opiates. It can be ground into a powder. It can be snorted. It has a street value of about $7 a pill. And I think bottom line for me as a clinician is I just want to be a little bit more cautious about prescribing Neurontin, especially to my patients who are substance abusers. So that's it. Thanks for listening and watching. I hope you enjoyed this issue. And as always, Please let me know if there are any other topics that you'd like us to cover for future issues of any of our newsletters. Thanks very much.